Welcome back to another episode with ByrdAdatto. And as we continue to imagine our new reality on this COVID-19 crisis, many of our medical clinics, they're using telemedicine to their advantage, which is very important, obviously, way to keep up with their patients and maybe set them up for maybe future services, especially in light of many states that are still dealing with the fact that elective medical services are either outright banned or been reduced to almost nothing.
Yeah, and we're seeing all sorts of creativity come out, and really today's message is a cautionary tale for everyone to realize that when you're solving for the issues with COVID-19 and the restrictions to your practice, to remember there's other restrictions out there, and so you can't just solve for one and forget about the rest.
Yeah, and an example that we had that was thrown at us recently was, well, what if I start using telemedicine as a way to provide medical services, and in doing so, I can kind of instruct a patient to do self-injections of Botox, kind of like a Botox party for one is the best way I can kind of describe it, which is, again, creative because you can use telemedicine to your advantage, and we know that our clients are trying to find other ways to interact with their patients, but clearly there's a host of concerns that the practitioner should be aware of. Look, number one is I'll describe why you're exposing yourself to malpractice claims, and number two, you potentially are going to open yourself up to some type of board investigations, and these are the reasons why. Number one is if you're asking somebody who is an unlicensed individual who's home to render medical services, injecting Botox in their face, in many states, you as a provider are delegating to an unlicensed individual. And a lot of states, you are only allowed to delegate to a licensed person, PA, nurse practitioner, RN. Other states, there are some supervision requirements. So let's just pretend you're a state that you can delegate to an unlicensed individual. But in many cases, when you are delegating to an unlicensed individual via telemedicine, in this case, you need to be on site with the person in case of emergency. Again, we just established the fact that you're doing this via telemedicine, and I'm unaware of any exception to that particular rule. Next is they're going to look at you from whether or not you're following the standard of care. So again, let's get past the unlicensed individual, the supervisions that we just described. As a medical provider, if you're directing someone to render medical services upon themselves, is that within the standard of care? Do you, the medical personnel, the medical provider, know whether or not that unlicensed person have enough background to actually properly put the needle in the right spot, the right amount of dosage, without permanently scarring and harming themselves? And finally, with all those factors I just described, I also think you're setting yourself up for a potential malpractice claim. Because if you are substantially outside of what would be considered the standard of care, and that patient is harmed or sustains some type of complications, I do believe you expose yourself in means in which you didn't mean to. Obviously, you're finding another revenue stream. And finally, last but certainly not least, is the threat to public welfare. A lot of states have this general global statement that you, a practitioner, can have your license revoked immediately if you're a threat to public welfare. And in many states, allowing elective services to be rendered is a threat to public welfare. Whether or not your medical board or nursing board would consider you allowing an unlicensed individual to self-inject themselves at home, that could again expose you to that. So those are just on the top of my head. Michael, I don't know if you have anything else you want to add.
Well, I would like to believe that most of our audience kind of started smiling, that they would not think to instruct a patient to self-inject. And I'm pretty proud of you, Brad, for explaining it, not just leading the entire presentation with no. I mean, if there's ever a time that we as lawyers can just say no, don't do it, I think this would be one of them. But what's instructive, if you can get past the craziness of the scenario, are all the things that Brad outlined are kind of the list that you go down when you're looking to, compliance, and whether or not whatever it is you're wanting to do is going to check those boxes. And believe it or not, Brad actually has gotten this question.
This is true. And I think the big takeaway for everyone is to understand that I understand there are a lot of different options that are out there. And again, Michael and I and many of our partners have heard lots of different ways in which you're trying to keep yourself up. We get it. We understand the frustrations you're having, but the point being is just because a crisis is happening doesn't mean these compliance rules go away. As I've told other people, the government has a long memory. So you may be doing fine and getting away with it right now, but that doesn't mean that they won't come back later and bite you. So be mindful these rules don't go away even during a COVID-19 crisis. And I don't know, Michael, if you had any other thoughts to go into that one.
It's great.
Perfect. Well, thanks again for joining us. And as usual, we like to keep you up to date. And we look forward to speaking to you next time.
Thank you.